Malaria is an infection that is in the blood, and it's caused by a parasite called Plasmodium. There are several different species of the parasite that cause malaria, and depending on the species, it can determine how bad the infection is. With the one called falciparum, that can be very serious, and people can die from malaria, particularly with that one. It's contracted from mosquito bites. So the Anopheles mosquito, which lives throughout the world, throughout a significant part of the world, bites usually at night, and in fact injects, when it takes a blood meal, it injects the parasite into your blood, and that is how it's contracted. The symptoms include aches and pains, nausea, vomiting, fevers, chills. Depending on the type of infection, like I mentioned, falciparum, if they're very sick from it and have a high parasite load, they can have a change in their mental status and even some seizures. They can have developing kidney failure, things like that. So they can be very, very sick, requiring hospitalization. It would take several days before they actually start feeling it. So what can happen is someone can come here either as an immigrant or as a returning traveler from an endemic area, which I will mention, and then start having fever, start feeling sick. And what we do is try to get a history. Have you been anywhere? Yes, I've been to Africa, I've been to Asia, I've been to South America, the Dominican Republic, Central America, just about many, many places. And then we do a blood smear, because we can actually see the parasites in the blood. Pretty much people who go to these areas, travelers who go to these areas, or even people who are coming from these areas, the thing is we try to prevent it. So people who are significantly at risk are travelers who have basically been there and have gotten mosquito bites, haven't taken prophylactic medication that they should take while down there, they're at risk. We don't really have a lot of that mosquito in this country, a little bit in the South, so you occasionally can hear about a case in maybe Georgia or Florida or New Orleans or Texas, but not really a significant problem here. When we see malaria, it's usually someone coming back from an area, an endemic area. Well, they come in with a fever. We always do blood cultures, but we also get a history. One of the big things with infectious diseases, we have to get a history and find out what's going on with the patient, where they've been, what they've been exposed to. And as soon as we know that they've traveled, one of the things we look for is malaria. So we would do the blood cultures, but we'd also we'd test the blood 3 times, looking at it under the microscope, do a special stain, looking for the parasite. We treat it, we do have anti-malarial drugs that we can use, and the treatment, I won't name all the different drugs, the treatment, you have to look at where the person has been, what the resistance is, because there are certain parasites that are resistant to certain drugs. But we treat them with the anti-malarial, and we treat them with supportive therapy, IV fluids, treat their fevers with acetaminophen or Tylenol or ibuprofen, whatever, if they're having problems with their kidney, if they don't usually need dialysis, but if they needed dialysis to help their kidneys, things like that, then we would treat them for that and treat them if they started having seizures. So anytime you're planning to visit another country, whether you're from that country or you're just visiting there as an American tourist, it's always good to go to your doctor and let that doctor know and determine if you need, if you need any medication for travel. So if you're going to an area that is that has malaria that's endemic to it, the important thing is for your doctor to know where you're going, because as I've mentioned, there are the different parasites have different resistance patterns. So we have medicine that we give as what we call prophylaxis. So you start taking that medicine before you leave for your trip, and then you take it during your trip while you're there, and then again you continue to take it for anywhere from a week to a month after you return from your trip, to make sure that that you've killed any parasites that may have entered your blood from mosquito bites. That's one thing. The other thing is that it's very well advised to take insecticide. Use something like DEET, D-E-E-T. I don't know the chemical name, it's a long name, but something that's maybe 20 to 30% DEET. Spray that on your clothing. Have nets, mosquito nets that are coated with something called permethrin, which will decrease the likelihood of you being bitten by the mosquitoes at night, which is when they really like to bite. Light clothing, like white clothing, white pants, long pants, covering up your skin is very important to prevent mosquito bites. And they're more attracted to dark clothing as opposed to white clothing. So light, white, yellow, things like that will help decrease your likelihood of being bitten by the mosquito as well. So all of those things are very important to try to avoid getting bitten by the mosquito, especially at night. If you can be in an area at night that's closed with screen doors, with air conditioning, and try to avoid stagnant water where the mosquitoes will lay their eggs, all of these things are very important. People die from malaria, so it can be quite serious.